As a globally recognized MedTech innovator known for breakthrough population equity and efficiency solutions, GeaCom's insights on post-COVID bring-up are of great interest to the market at this pivotal time. National medical executives have identified several key topics of interest, including improved infectious disease control, augmented virtual and personal engagements, and total population coverage and efficiency techniques, all to be discussed by GeaCom's founder and general manager in this short dialogue. Welcome to the CITE 2020 era.
Healthcare leaders like you are working diligently on strategies to bring services back up safely and effectively. Now, how can we turn the situation into an opportunity? How can we reimagine healthcare, make it more equitable, patient-centered, safer, and more effective?
The opportunity to bring things up more effectively and more equitably, well, I believe that opportunity has finally come. People have known for a long time some of the difficulties in healthcare around reaching entire populations, around keeping staff safe. But there hasn't been the desire strong enough to overcome the status quo's gravity. Till now, this pandemic has helped further inform us that FDA-qualified solutions that equally engage the entire population, that bear in mind the infrastructure needs and staff utilization, are more needed than people ever realized. There are consequences today that I don't think anybody's willing to go back to the old way. They are ready for the change. And that change is going to come with scientifically validated solutions that are vetted and tried and true in the marketplace, that are available today, and that don't lag for certain populations, but literally follow the guidelines of the CDC, population health, and effective communication. And fortunately, CITE systems meet all of these criteria.
At the same time, our communities are pushing for equity and civil rights. Our healthcare systems face unprecedented financial difficulties. The cost for healthcare procedures have increased by 18.2% over the previous year, and with COVID-19, America's hospitals lose an average of $50.7 billion per month. Some places are even at risk of closing unless the financial situation improves. So, how do we reduce cost and boost revenue without compromising care?
One of the challenges, I think, of bringing medical systems back online is the new demand for complete equity. Really, the healthcare world has struggled with this for 100 years. And now is the opportunity to address your patient population equally and then take on that variable for the economic benefit. So when you have a population coming through where some individuals take longer or need more resources or more time with staff, you can't predict that patient flow and you have an inability to affect your economics. But if there's a mechanism, such as a CITE method, where in spite of language, literacy, culture, race, and background, those individuals can be engaged more efficiently. For example, conventionally $1.66 per minute, through the CITE method about 2 cents per minute. With the conventional method about 70% accuracy, with the CITE method 100% accuracy. It better authors a chart, it gets upcoding for reimbursement, and it also provides new services to patients that they can choose to pay for that ultimately get more revenue back to the medical system. They get additional benefit in services, the medical system gets additional revenue.
Cost and revenue are closely tied to process and efficiency. So why are these key items for modernized care? Conventional methods lead to challenges where staff is overwhelmed with data entry, where patients are isolated, stranded in the waiting room, not progressing their care, and where resources are wasted on point solutions. So how can we boost efficiency, empower our patient population, apply staff in the most effective way, and coordinate resources to the point of need?
A lot of effort's been put into doing things like creating web portals for patients to pre-register or other techniques to try to get them to do more in that waiting time. You know, the 4 hours they spend for 5 minutes with a physician sometimes is very wide open for opportunity. But they don't want to do it alone. They're in a medical system to be engaged with medical professionals. Well, that's the beauty of the multi-path real-time messaging included in a CITE system. So when a patient is with Fraser Kitsune, they are not only authoring their chart, but they're real-time communicating with the nurse, with the doctor, with the medical record, and the staff that's going to treat them. It helps create better engagements between staff and patients. It helps coordinate care, and probably most importantly, it creates more active care zones Wherever your patient is connected to the staff and never alone. So CITE systems with MRM are an opportunity to get full-time equivalency, process improvement, and take complete control of your patient flow. Every strategy that's been employed since the beginning of the pandemic has been a one-to-one strategy, where a video conference is 1 minute of nurse time for 1 minute of patient time, or 1 minute of physician time to 1 minute of patient time. This does not scale. With the MRM and the CITE mechanism, patients progress through pieces of information that's shared to the staff member so that they can come in at strategic moments, and one staff member can effectively engage dozens of patients seamlessly, simultaneously, effectively. And the economic opportunity and the effectiveness is incredible.
And what about safety and security? When it comes to keeping patients, staff, and their data safe, there can be no compromise. So, how is Fraser Kitsune different than anything else out there?
Oh, this is an easy one. There really is no choice. There is only one medical engagement system that's designed to FDA standards, that's never been hacked, that's completely secure, that kills bacteria, fungus, and viruses on contact, and that's Fraser Kitsune. It's designed and built for the medical space. It's made in the United States domestically. It has never had its data breached. Conversely, consumer systems are designed for one thing, that's to exploit the user. They have notoriously been terrible with data security. Hundreds of millions of dollars have been wasted on data breaches. The cost of maintaining those systems is outrageous. They're designed for something else. Everything you do on those platforms comes with the burden of security, with the burden of cleaning, but further the burden of development. They just are failed systems. There is only one choice for medical grade engagement, and that's Fraser Kitsune.
According to a recent study published by McKinsey, the potential cost savings related to an efficiency-driven care model range from $1 to over $2 trillion in the next decade. While cost and efficiency matter today, you must continue to innovate to be successful tomorrow. So, how does Fraser Kitsune adapt to changing needs and support continued growth?
When the COVID issue started to unfold, we were suddenly faced with changing engagement sets, protocols, patient flow systems, process adherence, and it just turned into chaos. Our systems conventionally are incapable of adapting efficiently. Most adaptations of that level take 6 months and tens of millions of dollars. Conversely, with Fraser Kitsune, the systems that employed that platform were able to realize the adjustments in the engagement sets for patients and the process adherence to the MRM to staff in less than 24 hours at a cost of roughly $0. This is what Fraser Kitsune is designed for: adaptation and complete continual access to your population, your staff, and your infrastructure, and being able to make those modifications for efficiency and better results on a regular basis.
As the leader in medical innovation and equal, effective, and efficient engagement solutions, we are your committed partner. The time is right to take action and boost your strategy with GeaCom's proven solutions for the benefit of your patients, staff, and system.
This is an inflection point for healthcare, an opportunity to address a major pandemic with new efficiencies and innovation, an opportunity to change the way that we engage populations, to bring civil rights and equity to healthcare more effectively, and ultimately to do it with better economics and new services. Fraser Kitsune shows a fantastic path, proven, qualified, and vetted, to bring you to that stage quicker and more effectively, and to make this inflection point the most meaningful it can be. GeaCom has been working toward this for the entirety of its existence for more than a decade. Let us join you with what we can bring to the table to help create that better tomorrow for healthcare. Contact us now, and we'll be started immediately.